Facebook and everywhere else. Let me know that you can hear and see me. I'm just checking. So I'm going to talk a little, very briefly, about some training that I'm doing. I've been doing the last 6 months now. Let me just check. Yep, seems to be. Which is diagnostic ultrasound. So I'm doing my postgraduate certificate, put my teeth back in, postgraduate certificate in diagnostic ultrasound, specifically musculoskeletal for the lower limb. So part of this is I am doing like NHS clinic. So this morning I was over in the Queen Elizabeth doing a scanning clinic, and I also do York Hill Orthopaedics on a Friday afternoon as part of this training and mentorship. This is all part of my PhD, which focuses on rheumatology patients with some biomechanic focus and using diagnostic ultrasounds. But anyway, so I'm going through this training just now. It's a year long, and I am kind of halfway through it at the minute. And we've got, some of you that have maybe been in the clinic have maybe seen that we have the ultrasound machine in the clinic. And what I've been, I suppose, offering quite a lot of people is the opportunity to, if appropriate, to, during the treatment at no additional cost while I'm going through this training, to scan them. So I'm going to show you a wee bit about what diagnostic ultrasound is, what it's used for, what it's good for, show you what it looks like. If you're interested, if not, you can switch off. So this is the machine here. We've got a big beast of the machine in here. This is my transducer, and if you can see that, I've got the lights dulled because so that it allows me to see this grayscale image a wee bit better. This is a linear probe, so it's a flat probe. So some of you that have maybe had a baby or had a scan, you might be used to a diagnostic ultrasound, and it's a circular probe, and that's because they're going to deeper structures. Whereas for musculoskeletal structures, you'll generally use this flat type probe. So we call that a linear probe. Conducts through ultrasound gel. So we put ultrasound gel on. I can never get this gel out. And you need quite a lot of gel. Right, so just now, I'm going to just go to, excuse me while I just don't show you patient details on this. Go to myself, a new exam, scan. Okay, that'll be fine there. Yeah, you can't see that, that's fine. So we've got the skin up the top. This is frozen just now, so that's the gel all over it. It's going all weird looking. So if I just do, let's just do a thumb. Essentially, what we'll have, that's my ends, we'll do it that way. Placing this on, and ultrasound is great for soft tissue structures. So what I can see here, anything that is bone comes up as a kind of more white, hypoechoic, as we would say. And I can see the joint line there just at my thumb, just coming up. So it's not brilliant for assessing bones, but you can see the bones in it. But an X-ray would be your protocol if you're needing something with your bones. But certainly in rheumatology, I check for things like erosions, where there's essentially looks like we nibbling into the bones, where the inflammatory arthropathies have basically eroded some of the bones, and that's just some of the unfortunate side effects of rheumatoid arthritis and other arthropathies as well, not just rheumatoid arthritis, so ankylosing spondylitis, psoriatic arthritis, to name a few. So it comes up, so you see this grey scale, and it is like 50 shades of grey. I think there's something like 52 or something like that, 48 or 52 rings a bell, different shades of grey. And what we can see is this soft tissue as well. So I can see the tendon running along the top of this here as well. So I'm able to check if there's any break in the tendon. So I can check if there's ruptures. I can check if there's a tendinopathy. I can put on power Doppler. So I'll show you this. And you can probably see that kind of coming up red there. That's because I'm creating a wee bit of friction here. But say, for example, I wanted to check if there was an inflammatory process in there, I can actually see that. So if I'm checking a particular tendon or tendon sheath or a particular joint, I can then go in and put power Doppler on and check away. I can also check the flow. So this is flow here. Not something I tend to use, so something I will be really using. But if I was wanting to look at the flow of the vessels, then I could do that as well. So that's quite good for those that are maybe doing DVTs, checking for any thrombosis. That would be, ultrasound can be used a lot for that. But for me, for musculoskeletal, primarily tendons, ligaments. Hi, James. Check in with AJ. James, yeah, come and check in, definitely. So it's just showing you what diagnostic ultrasound is in musculoskeletal. So it's fantastic for allowing, so if I think that, say for example, plantar fasciopathy, obviously I'm not going to get my foot out here, but I can actually check, I can actually go in and see is there active inflammation in there, I can put power Doppler on. So it kind of would look, not as, you can see that I'm creating friction there, but generally if I put that over the area of interest, and that's a wee vessel that's flashing there just now, but if I was getting little speckles of red, so you can see that red there on the screen now, then that would indicate that there's quite possibly an inflammatory process going on. And that helps us with management. So that helps us with, do we, is there something going on systemically? So is it something in your body that's the problem? So, have you got some sort of immune thing going on that we need to refer you to, back to possibly your GP, where they can maybe refer you back onto possibly rheumatology if that's what you're needing. Or it might be that it tells us that we maybe need to do a steroid injection into the area. That can be something that we can actually see exactly where you're needing it, depending on what it is. It might mean that we need to offload something. So we had a patient today in hospital where tib post, so tibialis posterior tendon, she just had to be offloaded. It was just literally just lit up as soon as it was on. No, we'd already been and checked if there was any risk of rheumatoid. There wasn't, so we knew it was some sort of loading issue, and so we had to offload her. So it just helps you with management, and it gives you a concrete and a more concrete answer. It's just one modality. So as I said, it's not great for bones, although we can see the bones. I don't know if you can see, so I'll turn off power Doppler. It just shows more where the bone is, it will show more white. So you can see that reflects. So I can see the joint line there. So if I was maybe injecting into that joint line, it's great for that because I could actually see the needle going in. Obviously not the thumb, I wouldn't be doing the thumb, but more talking about the foot and ankle. Or if I wanted to check, is it the tendon sheath rather than that within the body of the tendon? Is it is it more that the tendon sheath that's got some sort of inflammatory process going on, or is there a tear? Is there, what actually is it? And I think that's the for want of a better way of when we're working with people and we're assessing, a lot of the times it is through elimination of things, checking for things, saying, right, it's not that, so let's move on to the next thing. And when you've got a tool like this, it just helps you with that diagnostic. This is what it may be. It's an additional tool that gives us more information. It's not the be all and end all. So it is for soft tissue. So soft tissue is like your tendons, your ligaments. It can be the cartilage. It can be the joint capsule within the joints. We can see all of that. We can see any inflammatory process within the joint and within the tendon sheath, within the tendon itself, within the tendon body. So it just confirms sometimes let's actually get the ultrasound scan on there and just confirm what my suspicions are, and get a more accurate diagnosis, I suppose. But also for things like guided injections, it just means that, so for example, in orthopedics, sometimes the surgeon wants us to inject steroid into a particular joint. So we need to make sure that it is actually in that joint and we've not just missed it. Because if you're just doing it via surface anatomy and you're just going, yeah, that's where that joint is for most people, most people's anatomy is not the same exactly. So it just makes things a bit more accurate, or a lot more accurate. And so that's diagnostic ultrasound. So I'm, as I said, halfway through my training at the minute. And it's going well. It's intense. It's an intense course. If there's any other podiatrists out there or physios out there thinking of doing it, and if you work in musculoskeletal health, I would thoroughly recommend doing it. It will massively enhance your diagnostic skills and your patient outcomes as a result of that. I've had SG perform analysis at my calf and received the patient report results. Friendly and professional, highly recommend. Thank you, Roberto. And yeah, it's getting that confirmation. And I'm not saying what Robert was in for, but it was just a few weeks ago, wasn't it, Robert? And it just confirmed what we suspected, but we actually saw then, and it gave Robert that peace of mind that actually, yeah, that is that. And here is what we then do. So we now have a clear plan, or it's maybe ruling some other things out. So sometimes you can find like lumps and bumps and things on feet or foot or ankle or leg or whatever, and you get this kind of lumpy thing and you're thinking, what is that? So it's great for that as well, so we can rule things out or send things for further investigation or aspiration or whatever's needing done. So it's good for that sort of thing too. But it's definitely a beast. It's a beast to learn. It's like a whole other language I'm learning, and an amazing skill that I'm sure will massively serve me through my career in musculoskeletal health. So I'm thrilled to be doing it. But my main reason for doing it, well, not my main reason, one of my reasons is as part of my PhD. I am going to be scanning hundreds of rheumatoid arthritis patients, and I'm basically looking at them over a period of time, probably about 18 months, and we're looking for any changes. So essentially they'll get a baseline scan and then they'll get a scan again, no doubt, at 18 months, and it is to test something against something else, if that makes sense. So you're basically, does something predict an outcome or not? So that's the idea behind it. But anyway, that is it. I thought I would jump on quickly while I had a wee 10 minutes to talk to you a wee bit about diagnostic ultrasound, what it is. Many of you within the clinic have been asking about it. It's not something that we're promoting just yet, because until I am fully doing this, it will not be something that I will readily offer as a service that you can book in. But certainly if you're coming in to see me for any sort of musculoskeletal issue, and it's something that we felt would be of benefit, I would always ask if you're okay if I used it to check, and we would then use it as just part of your diagnostic that I would do anyway, but I'm just using it in addition to, and it's all part of that, getting you some answers, and then from there getting, well, what do we then do with that? How do I get out of this pain or injury or whatever it is you've got? All right, I will sign out. Remember, if you have any questions, please just jump on and ask. Always happy to answer if I can. Have a fabulous evening, and I'll see you soon.